I'm Bethany. I am a student nurse. Close your curtain for privacy. How are you this morning? Alrighty. Well, I am here to help give you your medications. Can I have your name and date of birth? Okay. Miss Martha May. And Miss Martha, what's your birthday? Oh, your birthday should be here somewhere. Nine 12/1949. Okay, is that right? Okay. So for your medications this morning, it was written that you like to have your insulin at 7:30. So we're almost about that time frame for your insulin. Is it okay if I give you your medications right now? Okay. So let's get you set up first, because we do have some oral medications, some capsules for your fluoxetine. Are you able to swallow okay? Okay, and is that okay? Alright, well let me get some hand sanitizer on here and some gloves. Alright, so your fluoxetine, doctor ordered 60 milligrams every morning for you. I have some water for you. Okay. And we'll initial that. Right there. Okay, here's some water and here's your pills. Okay, you got those taken. Alright, do you have dry mouth with taking your fluoxetine? Okay, well, I can always make sure to have the assistant personnel make sure your water is always full for you, and maybe with, if it's okay with the doctor, some candy and gum to keep your mouth moist. Alright, and do you feel drowsy after taking the medication? You do? Okay, well we can talk to the doctor possibly about getting that changed to the evening, so the effects are drowsy in the evening when you need to sleep. Okay. Alright, well your insulin, we're going to give your NPH 10 units, and your Lispros 2 units. Okay. I need to get the injection pad. And we're going to give this on your arm there. Well, no, not your arm, your abdomen, if that's okay. Okay. And you had it on your left side last time that I noted from when they gave it to you last. Okay. And I'd make sure to rotate your spot. So your insulin's for your diabetes, and it's for your blood sugars. So we'll check your blood sugars throughout the day and maybe change them depending on how your blood sugars are doing, and discuss that with the provider to know what's the best plan for you. Do you have any questions about your diabetes, your insulin? Okay, so with my gloves on, we're going to clean the skin. Alright, 20 seconds. Circular motions, inward and outward. Have a cotton ball in hand. Okay. Put that away. Alright, so insulin. 12 units. Okay. Alrighty. Alright, 1, 2, 3. Keep that in there for about 10 seconds. And then draw, put safety on, put it in the sharps. Okay. Now we're going to give you your ceftriaxone, which is for your UTI. provider ordered it for 5 days, and it's your urinary tract infection, which is an antibiotic. Have you been having any itchiness, like swollen throat, rash that you've seen? Okay, those are signs of an allergic reaction, which we'll want to know if you do experience, okay, and we'll notify the provider. Okay, and I'll check too, but right now, no rash is what I see, but no itching or swelling. Okay, so I need to give this in a deep muscle, so we're gonna put it on your ventral gluteal muscle, and which is your hip, where your hip muscles are. Do you have a preference of which side? Okay, so we're gonna have you go on your left side, and I'm just gonna fill for my placements here. The top of your iliac crest, and notice my V shape, pinpoint an area. So we're gonna go on your right ventral gluteal, and clean for those 20 seconds. Okay, I'll have Band-Aid and cotton ball on hand. Confirm that this is my ceftriaxone, 0.5 grams. Okay, and I'm also documenting, I documented the insulin and the ceftriaxone. Well, I will after I give it. Okay. Alrighty. Okay, here we go. 1, 2, 3. Do that a little bit slower. And I would take it out in a more quick, I would take it out at a faster pace than slow. Okay, cotton ball, Band-Aid, safety, and sharps. Okay, all right, how you feeling? Okay, we'll get you repositioned. Alrighty. And we just want to make sure your ceftriaxone is continuously given for those 5 days, so the antibiotic is effective when we can get your urinary tract infection treated. Okay, so your next medication here is your cyclopentolin, which is for your vitamin B12 deficiency. So just maybe through your diet that you're low in areas of meat or eggs, or just not able to absorb that nutrition well. So once a month, does that sound correct? Yep, we're gonna give your vitamin B12 injection, and I'm gonna give it into your arm, deltoid muscle. Do you have a preference of which side? Okay, right side. So cyclopentolin, 200 micrograms. Okay, I'm going to clean first. Feel for the top of the chromium process, 2 fingers, and go down. Clean for 20 seconds. Okay. Cotton ball and Band-Aid on hand. All right, have that dried. Okay, 1, 2, 3. Alrighty. Okay, safety, cotton ball, Band-Aid. Alrighty, your last one here is your tuberculin. And it's not a medication, but it's a tuberculosis test, which tuberculosis is affect your lungs and your immunity. So we just want to make sure you're okay with that. I'm getting that test, and then also we just want to make sure your lungs and your immunity are within check. Do you have any questions? Okay, so I'm gonna look at your forearms here. I'm gonna notice any lesions, skin discoloration, tattoos, hair, moles, and from what I see, I'm gonna use your right forearm. Okay, and we're gonna clean here. We're not gonna use any cotton swabs or Band-Aids because we just want it to leave it be. And then in 48 to 72 hours, we're gonna have it read. And if there's a positive reaction, you're gonna have an induration, which means like there's a hard bump. And if that does happen, you do have a positive reaction, and we'll have you be treated for that. So the tuberculin, 0.1 milliliters. Alrighty. Okay, with bevel up, we'll pull back. Alright, okay, safety. Alright, how are you doing? Okay, good. So at this time, I'll go to my MAR, and I'm confirming and documenting the location and time that it was each given after I gave it. And then answering any questions that she does have about her medications. I could have added that her fluoxetine is for her depression. I did mention that to her. And then just make sure everything's documented correctly. Put her back into a comfortable position and give her her call light. Remove the curtain for privacy, hand hygiene, and make sure she's good before I leave. Okay.